With our faces pressed to the cold concrete corner of our cell, we watched while the guards, wearing respirators and black leather gloves, took Sanders and Williams to the Disciplinary Segregation Unit, DSU, also known as the hole. After they disappeared, I turned to my cellmate and said, "You're not getting sick." He understood. I was not telling him that I expected him to avoid inhaling invisible COVID-19 molecules if they filtered into the bathroom with bunk beds we share. I was saying that even if either of us got sick, we were going to ride it out without saying anything. By placing those who are sick in the hole, prison officials were sending a clear message. Getting sick is a serious violation of the rules, punishable by solitary confinement. No one wants to get sick, especially with the coronavirus. But the last thing anyone wants in my prison is for the guards to think you are sick, because then they will isolate you in the hole. Existing in the hole is a kind of living death, and many prisoners would risk real death rather than a prolonged living death. I know I would. I've spent time in solitary confinement. Another American prisoner, Harry Hauser, summed up solitary perfectly when in 1840, he called his state prison cell a living tomb. The hole is miserable. And with the arguable exception of the death penalty, solitary confinement is the most violent punishment still legal in the United States. Most European countries consider long-term solitary a form of torture. I spent most of my time in solitary wishing for death. Social researcher Lisa Gunther sums solitary up as well as an academic can who has never been in isolation themselves. Quote, "There are many ways to destroy a person, but one of the simplest and most devastating is through prolonged solitary confinement. Deprived of meaningful human interaction, otherwise healthy prisoners become unhinged. They see things that do not exist, and they fail to see things that do. Their sense of their own bodies, even the fundamental capacity to feel pain from that of others, erodes to the point where they no longer are sure if they're being harmed or are harming others." I nearly lost myself over those months in solitary. I had moments when I couldn't tell the difference between the concrete cell walls and the living cells in the nerve endings of my fingertips. Trauma researcher and medical doctor Basil van der Kolk states, quote, "Trauma robs you of the feeling that you are in charge of yourself." And solitary confinement is an extraordinary experience of prolonged trauma that robs you of being constantly aware of your own physical and emotional existence. Now, I know the extent of the significant suffering I caused others with my violence. I also know that in response to the harm I'm responsible for, the state deeply traumatized me. It's not for me to say whether this was justice or not, but the impact those months of solitary had on my young mind and body are still with me today, years later. The hole is a weapon used to destroy someone's humanity, and I would rather die than return to that place. When it comes to COVID-19, there are certainly other places in my prison better suited to isolate people for medical reasons than the hole. The hole has bars where air flows freely between cells, but in other units, cells have metal doors where the air must pass underneath. These types of cells would surely be a better place to isolate sick prisoners. Yet, at my prison, if you get sick, both you and your cellmate, whom you could have met yesterday, are going to the hole. Perhaps this is logical from a medical perspective, but that's not why this protocol is in place. The reason they decided to do this is because they know cellmates will hold each other accountable and make sure that no one complains to medical about getting sick in their prison. This is what it's like in the hole. Inside, you get nothing except a mattress and a toilet. You're allowed no personal property, with no exceptions, even if you're placed there solely for medical reasons. You're considered lucky if you get a book. Many of the novels in there have the last 10 or 20 pages ripped out because some sadistic guards feel we don't deserve to enjoy Tolkien's or Harry Potter's conclusions. I know the power of books because for my whole adult life, I've tried to keep my soul alive. During my time inside, one of my primary goals has been to avoid going to the hole ever again. Advocates of this form of punishment point out that I work so hard to avoid going precisely because it is so terrible, that it is the ultimate deterrent. And while yes, threats of punishment do help conform behavior, some punishments are simply too severe and end up being counterproductive. At a certain point, the severity of a punishment becomes irrelevant and ends up telling you more about the government's agents who promote such grotesque punishments than it does about any form of misconduct. I am an adult, and I follow the rules primarily because I try to be a responsible and pro-social person. I'm also lucky to still have my wits about me enough that I can constantly do so. Many people with untreated mental health disorders are the first to fall victim to the hole's horrors. This place of extreme punishment loves swallowing up our most psychologically broken citizens. The hole, like prison, is filled with people who are broken, not evil. Solitary, like prison, is a counterproductive form of punishment because it is dramatically overused. While many countries have either eliminated or dramatically reduced forms of prolonged solitary confinement, with positive public safety results, American prison officials have continued the practice for some reason. Many American prison officials will state that the use of solitary is essential to the good order and safety of their institution. However, the use of solitary confinement, like prison itself, should be the last resort for any society, rather than the first reaction to misconduct, especially for children, those with mental health disorders, and those with substance abuse issues. Facilities that reduce their use of solitary end up being less violent, which reduces recidivism. The data strongly suggest that using solitary confinement less often actually increases public safety. It makes perfect sense that prison officials believe the hole is the key to how they should fight COVID-19 because disciplinary isolation is the go-to solution to any problems in American prisons. I think some prison officials honestly believe they can punish this virus into submission. At my prison, you can go to the hole for being involved in violence and extortion. You can go for rape. You can go for consensual sex with another prisoner or staff member. You can go for smoking weed or cigarettes. You can go for lying to an officer, for having too many pieces of fruit, for kissing your visitor too long, for not having your shirt tucked in, for having your fingernails be too pointy, for complaining about a staff member on a recorded phone call, for having the wrong kind of haircut, for hoarding toilet paper in your cell, for having an extra t-shirt, for having your religious items like a Eucharist or medicine bag outside of your approved religious storage box. That is, you can go to the hole for virtually any reason at any time. How a violation is punished is often an entirely subjective decision made by a random guard. I would go to the hole certainly if the wrong one found me writing this. Most of the people in the hole at my institution are currently there not for acts of violence or severe misconduct, but for petty offenses. I'm not sure if having COVID-19 is considered a major or minor form of misconduct at this point, but prison officials know they'll look bad if their prisoners get sick right now. So it's important to keep their numbers low. Plus, they won't have to test us if we don't complain. So I will not be getting sick, no matter how bad my cough gets.